¿A qué WhatsApp?
Ay, vamos a ver si me funciona con ella.
Está funcionando.
Hola, hola.
Buenas. We are live.
Yes.
Hello. ¿Cómo ustedes están? Buenas tardes. Hola,
Hola,
hola, hola.
hola.
¿Cómo están todos?
Hola, doctor. Bienvenidos todos acá. De este lado, para los que no me conocen todavía, por el lado de Surgeon, mi nombre es Maciel Cisnero. Nosotros representamos Surgeon Med Network y New Life Recovery House. Le damos hoy la bienvenida formal, muy encantada de estar aquí, sí, al doctor Clime. Esperemos que todas sus preguntas puedan ser contestadas. Y nada, que disfrutemos esta entrevista. Doctor Clime, bienvenido.
La verdad, muchísimas gracias. Está de más decir que somos familia. Nuestra relación es quizás la más antigua que tengo en cuanto a trabajo de cirugía plástica. Bueno, conocemos desde hace mucho realmente.
Sí. Para no decir muchos años desde que estábamos pequeños. Si no
Exacto,
mencionamos edad, por
exacto.
favor, doctor.
Gracias.
Por favor, doctor. Vamos a ver. Ok. La doctora Maciel Guzmán le manda un saludo. Su hermano, ella dice que usted es su hermano, doctor Clime.
Realmente, mira, Marcelo es una de las mejores cirujanas. Realmente trabaja muy bien. Es
Sí.
excelente médico, de verdad es un honor.
Es
tenerla
parte de
como-
nuestro equipo,
Exacto.
sí.
Es un honor tenerla como amiga y como colega.
Ok. Alexandrich también está en línea. Ok, vamos a hablar de Enriquillo Clime. Vamos a hablar de cómo inició, dónde estudió, dónde labora, qué
Pero
es lo
bueno.
que más le gusta de la cirugía. A
Ok.
ver.
Mira, yo soy egresado de UNIVE, hice medicina en UNIVE. Mi vocación o decisión de hacer cirugía plástica viene desde niño, porque cuando éramos muy jóvenes, un primo mío se quemó 87% de la superficie corporal. Y estábamos muy jóvenes, muy chiquitos, casi no habían plásticos en el país. Entonces, el impacto y el tanto oír que tiene que venir un cirujano plástico y la importancia del cirujano plástico, que cuando ya lo vi al cirujano plástico, fue como que viese a Dios y dije, no, yo quiero ser ese tipo. Entonces, entré a la universidad ya pensando en hacer cirugía plástica. Cuando terminé mi entrenamiento, hice mi pasantía en Corazones Unidos, clínica donde todavía hasta el sol de hoy laboro. Después inmediatamente me dirigí a Brasil. Hice mi primer año en cirugía general en el departamento de mastología del Hospital Santa Rita en Victoria.
Okay.
Después me fui a Río de Janeiro, donde hice 2 años más de cirugía general en la Santa Casa de la Misericordia.
Okay.
Ahí entonces ya es que la plástica en la Casa de Portugal, hago 3 años de entrenamiento.
Okay.
Y después entonces hago un fellowship de estética y rinoplastía vía LISAPS en Carolina del Norte, Texas y Nueva York.
Wow.
Entonces ya me sentía lo suficientemente entrenado y capaz para venir a laborar. Entonces vengo al país, me instalo en Plasticenter, que es aquí en Naco, que es donde tenemos nuestro consultorio, donde tenemos nuestra práctica. Y lógicamente trabajamos en otros centros también. Laboramos, como dije, Clínica Corazones Unidos, en el Centro Médico Punta Cana.
Okay.
Algunos de nuestros casos también los hacemos en el Instituto de Cirugía Especializada.
Okay.
Y también hemos trabajado en el Centro Médico Bornigal.
Okay.
O sea, que estamos bastante asequibles.
Sí,
o sea, que
sí.
No es complicado estar, o sea, nosotros tenemos un acceso bastante tranquilo y fácil.
Okay. Entonces vamos para nuestras chicas en inglés. Su presentación en inglés.
Alright, let's do this. So, my name is Enriquillo Clime. I did my med school in UNIVE, which is in Santo Domingo. Then I did part of my training in Brazil. The first year I did in Victoria. Then I moved to Rio de Janeiro when I did 2 years more of general surgery. After that, I started doing plastic surgery, 3 years. And then I did a fellowship in the United States in North Carolina, Southwestern, which is in Texas, and New York City. Right now I work in Santo Domingo, but I also work in Punta Cana, and I also work in Puerto Plata. It's very easy to access me because I'm the only Clime as a surgeon.
Okay.
Okay, hello doctor.
Hello.
We're just gonna make some questions
Sure.
for you, and hopefully you can answer some doubts that the adults may have.
All right.
Usually, you just said where we can find you location in Santo Domingo, but for the people in the internet, would you tell us your location in Instagram,
Oh, yeah,
Facebook,
yeah.
and other
I
social
think
media?
exactly, social media, my social media I think is really easy because it's Dr. Clime, and that's everything. That's drclime.com, that's my website. Dr. Clime, you can find me on Instagram, and you'll also be able to find me on Facebook. I have a Twitter account. It's not that movable, but you can also find me on Twitter.
Great, great. So we got the first question of one of our patients. She asked if you work with bariatric patients, but it will be we will need to be more specific, like if
Oh yeah. I'm assuming that you're a patient that lost weight,
Yeah.
or you're a patient that they are bariatric, and you're looking for a plastic surgery in terms of body contouring and reconstruction. And yes, we do that. We do that very successfully, actually. We have great cases. I will be posting some of them perhaps next week. That way you can evaluate the results. Normally, it's really hard to do post-bariatric surgeries in one procedure. You might need more than one procedure because sometimes you might need an arm lift, a tummy tuck, a breast lift, and so on. And it's not safe to do everything together. But contact us and we can evaluate your case.
Okay. She said that in her case she lost around 100 pounds.
Oh wow, congrats. You should be really proud and really happy for you. 100 pounds, when you think about bariatric, it's something that it would be considered normal. So contact us, we can evaluate your case and see if you're a good candidate for a plastic procedure, and we'll be happy to serve you.
Great. So now that we arrived these kind of patients, what will be your criteria related to the body mass index? What will be the limit?
All right. I try to stay below 34. I've done cases a bit higher. I did a 35 last year, but normally I try to stay less than 34 because it's safer. Normally patients that have higher BMI, they have higher risk of cardiovascular complications. And we try to make sure that they understand that it's not just for the result, it's also for the well-being, it's also for the health. The ideal BMI should be around 28, 29, but we know that's not most of the cases. But if you're between 29 and 33, you might be a great candidate.
Okay, great. So in those cases, and generally, what should do the patients to prepare for surgery before coming to the Dominican Republic to see you?
Normally I'll try to contact them and we'll have a medical form so we can have their medical history and we can do an online evaluation. During that online evaluation, we'll know her medical history. We also see photos of what's her current case, so we can evaluate what would she be a good candidate for, and we'll come up with a quote or a treatment plan. Once that's done, if the patient is able to, it's ideal for her to visit her primary doctor. That way she can run some lab work before and make sure that she's clear for surgery. And we can book the date around where it's more convenient to her and to us. And normally it'll take around, the whole process will take around perhaps 15 to 10 days for the first contact, for the day of the procedure. So the sooner as you contact us, the easier it is for us to help you.
Great. So there's something that is pretty important for most of the patients. In this case will be the hemoglobin levels. What will be the minimal or at least the proper values that a patient should have for determined procedure?
Alright, so let's say it's just one procedure, like a breast lift, a blepharoplasty, a not too large lipo. If you do within the normal range, between 12 and 13, you're okay. If you're thinking about a mixed procedure, let's say a tummy tuck and a lipo with BBL, which is kind of common procedure, then you should be higher than 13, at least 13 and a half.
Okay, that's great, doctor. So, besides the red cell counts, and what other tests or what other screenings do you do to patients before surgery?
One of the most important screening right now, I mean, you do have to do the blood work. We have to see if you have coagulation problems. Your blood sugar level is really, really important because if you have high blood sugar levels, you might not be able to heal or scar properly. Another thing that's really important is your platelets count because we want to make sure that you don't bleed out during the procedure. But right now, and we discussed this actually this week, one of the most important things is an evaluation by a pneumologist. Not only the cardiologist, but also the pneumologist, because we want to make sure that you're able to sustain the trauma of surgery. We want to make sure that you're okay with being laid down for a while, because we have now more experience and we understand better that most of the complications in plastic surgery are related to blood embolism, and normally they go to the lungs. So that's why having the evaluation of a pneumologist and being ready by a pneumologist is really important.
Okay. One of the patients asked related to the hemo. In the case of a patient that is always, let's say, borderline low on the lower end, what recommendations or what things could be done to help her out to have a surgery?
All right, so if it is a common thing, then you need to see a rheumatologist, because if it's common, if it's constant, then you need treatment. You might need treatment. However, if it's something that's not that common, it's something that fluctuates, iron pills, vitamin C can help you a lot. One of the recommendations that we normally do is if you know you have a low blood count, please contact your primary doctor, do the check-ins. Make sure that if it's normal, it is for a reason. Sometimes it's because you have a really important bleeding during your menstrual cycle. Sometimes can be a deficiency. So we need to detect what's going on, and once that's clear, we can treat you best. So if you have any questions, you can contact us and we can send you information, and even we can send you contacts to some primary doctors that work with us in the United States.
Well, that's great. That information should be given later. But to keep up with the interview, what are the procedures that you can offer to the patients, just for them to know what will be your area of expertise in detail?
All right. It's funny because my main field, what I did most of my training is breast surgery. So I do a lot of breast surgery. It was basically breast and nose. That was the stronger points of my residency. During my fellowship, I did a lot of training with butt implants. So I also do a lot of butt implants. Once I get to the ER, and I realize that most of the people that come to the ER are looking for body contouring, I take some classes in body contouring, so I'm really good in body contouring, which is tummy tuck and liposuction with BBL. I feel confident saying that I'm really good in most of the fields, especially breast, bottom, and nose.
Great. So, for more details in the area of breast surgery, so you specialize not only on implants, but tell us about the reconstructive part of breast surgery.
So the first year of my residency, and I was in a women's institute, so we did a lot of breast reconstruction. So I'm able to understand different types and techniques of surgery that will allow me to reshape and redistribute your breast, and in some cases reconstruct. Let's say you're a patient that went through cancer and you need a breast reconstruction. We have great experience with it, and sometimes we don't need to use implants. We can do it with your own tissues. So depending on the case and depending on your needs, we have different approaches, different techniques. I feel really confident saying that most of my patients are really satisfied with the results, and we're really thorough. We take care of the minimum details, making sure that it looks natural, normal, and it's symmetric.
Okay, great. Well, now that we know your main specialties and the procedures that you work with, let's talk after the surgery is already done. What are the steps that you take to make the post-operative period more safe or more, let's say, easygoing for the patients?
All right, that's a wonderful question. And one of the key of, I would say, my success is actually the teamwork. Normally we all try to work with certified recovery houses. That way we can guarantee that our patient is taken care of, that our patient is safe, especially if the patient coming from the United States or from another country. We make sure that our patient also receives a diet because you need to make sure that you're eating properly in terms that you need to heal, you need to scar, so we need to make sure that you have a proper diet. The use of antibiotics, painkillers, antithrombotics is mandatory. The use of a garnet. In case of body contouring procedures like liposuction and tummy tuck, the massages are really, really, really important. So we have a lot of stuff because I always keep telling my patients that the surgery is just a few hours, but the post-op is months. And those months are more important actually than the surgery. So making sure that you follow protocol, making sure that you follow our recommendations will guarantee a good result.
How many days after surgery the patient can start the massage?
Normally I'll start 3 to 4 days after the procedure.
Okay.
In cases that the procedure is a bit large, we might do it a little bit sooner, just making sure that there's not a lot of fluid retention.
Okay.
Okay. So, now that you speak about the fluid retention, which is one of the things that can appear after plastic surgery, which one are those things that most patients tend to suspect, but they don't know what what they are really, or
Right.
not themselves complications, but things that can normally happen after surgery, but they might get worried about.
Alright, so what's normal after surgery? Let's discuss what do you expect. So let's start with the most common surgery in plastic surgery, which is liposuction. Liposuction is the most common procedure in plastic surgery. So let's start with a liposuction. When you do a liposuction, you're taking fat out from a tissue. So technically, I'm creating a gap, and the body doesn't leave empty spaces. So that empty space will get filled with fluid, your own fluid that's coming from your own blood, which is a part of your blood that contains a serum. That's what the name is enrollment, because it's an accumulation of liquid on the gap that I created during the procedure. That accumulation of liquid is really important to be removed for several reasons. One of the reasons is pain. It's caused to be swollen, so if it's swollen, it's painful. Another reason is if you have a lot of fluid retention, and by any chance the bacteria might fall into that fluid, it's gonna feed out of that fluid because that fluid has protein. So the bacteria, it's gonna actually get stronger. And another reason is that all liquids make waves. So sometimes you might see some skin irregularities because are caused by the waves of the liquid. So that's why you need the massages. The massages will drain that liquid and guarantee that liquid is drained properly.
Great. So one of the patients asked, just changing the subject, if a patient is prone to keloids, what will be the approach to prevent them, or what kind of therapies can be given to prevent them?
It's a very reasonable question. You do need to understand that a kilo by definition is a tumor, so it's unpredictable. So if you did a kilo before, you're not necessarily going to do it again, but let's say that you are prone to it. There's a therapy called beta therapy, which is a radiation therapy. It's like radiotherapy that we do on scars. So let's say that I did a tummy tuck. Right after the tummy tuck, once I close, I'll make sure I close really neat, really tight, really clean, and I'll put a special wound cover. That way, 2 days later, you can have beta therapy, and that will help you a lot to avoid the keloid.
Okay. So, just to keep going with other things that might happen, there are some conditions like smoker patients or patients that have they use alcohol more than normal. What preemptive measures you can give to those patients, especially the smokers one?
Okay, so you do need to understand that smoking, it will cause nicotine consumes oxygen. And you need oxygen, you need that oxygen in your skin if you want to be able to scar properly. So if you're looking for a good scar, if you're looking for a good result, then you need to try to stop smoking at least a month before your procedure. And you need to understand that it's really important for you to cut down. Let's say you smoke 5 cigarettes a day, and you're thinking about a procedure, you should be cutting down by 2 and then by 1. That way your body kind of compensates a little bit and it's ready for the procedure. One of the things that I try to explain to the patient is also that the cigarettes sometimes can have or can increase the risk of vascular episodes, like thrombosis and so on. So, cause it causes your blood vessels to be rigid. So, if you're a smoker, we might need to do more measurements to make sure that nothing happens, like traveling socks, like getting you into treatment before the procedure, using blood thinners right after the procedure, and so on.
Okay, great. Going back to the post-operative period. So, what are the advices that you can give the patient after surgery regarding the wound care, like how to avoid infections or how to maintain the area clean?
Okay, one of the secrets, normally right after the procedure you cannot shower because most of the patients will have drainage and the drain cannot get wet. So normally you won't be able to shower your whole body. But let's say the drain is out and you're already able to shower. One of the most important things is keeping the area dry. If you just took a shower and you're probably going to use a special soap, you need to make sure that you dry that area properly. Most of us will also prescribe creams, antibiotic creams like Neomycin, Curaderm, and so on, making sure that that area is bacteria free. But you need to make sure that you have a proper hygiene. You need to make sure that area is pat dry, that the area constantly, if you see any kind of fluid, any kind of difference, any kind of redness, you need to let us know. Because if it's cut early, it's fixable really easy. But if it's too advanced, we might have complications.
Okay, you just mentioned the drainage. So some patients always are anxious about it. So how long will it take to be withdrawn from their body? Like for how many time, from how much time will they have the drain with them?
Yeah, it depends, but normally it will go either to 5 to 7 days. Most of the cases, we remove the drain when it's producing less than 70 ml per day. That's in 100. And that normally takes between 5 to 7 days.
Okay, great. Okay, let's see.
Vamos a hablar un poco, doctor, de los implantes en los glúteos.
Sí.
Vamos a eso, denos una breve explicación de ese tipo de cirugía.
Exacto, una de las cirugías que más me apasiona, una de las cirugías que más ha revolucionado el mercado. ¿Por qué? Porque durante muchos años los pacientes que no tenían la suficiente grasa para un aumento sustancial con su propia grasa no tenían opción. Porque las otras opciones que se comercializaron y se volvieron populares eran sumamente dañinas, que son los biopolímeros. Y tenían efectos secundarios atroces, las pacientes tenían deformaciones, etc. Entonces, el implante de glúteo viene como una solución para ese paciente que es un poco más delgado, no presenta la grasa suficiente para un aumento relevante, pero desea un aumento en esa región. El implante es un implante sumamente resistente, es un implante que normalmente es colocado en un bolsillo que hacemos dentro del músculo glúteo mayor. A diferencia del implante de senos, que a veces puede ir por encima o por debajo del músculo, como el músculo de los glúteos, cuando vamos caminando, el implante tiene que moverse, cuando nos sentamos, el implante tiene que moverse. El lugar más anatómico y más fácil del punto de vista de resultados y más seguro para el paciente es crear un bolsillo dentro del músculo, para que cuando el paciente se siente, el implante también se pueda mover y para que cuando el paciente camine, el implante se mueva con ella de manera natural, no sea una bola rígida, porque no se ve estético. Los implantes vienen de muchos tamaños. Es difícil decir que el aumento con implantes es un aumento brutal, exagerado cuando se coloca dentro del músculo, porque el espacio dentro del músculo no es tan grande. Es lo normal es que vaya más o menos desde los 300 a los 450 cuando se está hablando de implantes grandes, aunque la gran mayoría de pacientes con menos volumen, le hace 250, 280, 320, tienen excelentes resultados porque no es solamente que el glúteo se vea grande, que se vea levantado, que se vea natural, que se vea redondo. Entonces, el implante nos da eso que no nos lo puede dar la grasa, pero además de eso nos da otra cosa, que es que no se absorbe. Si yo te puse 250 y mañana tú entraste en una dieta radical y perdiste 25 libras, eso no va a afectar el resultado de tu glúteo porque el implante no va a perder peso.
No.
Entonces tú vas a mantener el resultado y el volumen y la proyección que deseas, aunque tu físico cambie, que eso no pasa con un BBL.
Ok, entonces vamos a explicarles eso a los pacientes en inglés.
Perfecto. Alright, so we're talking about buttocks implant. It's one of the procedures that makes me the happiest. And it makes me the happiest because it's a really innovative procedure. During the early 90s, during the late 80s, the patient didn't have any options. If the patient didn't have enough fat for a substantial fat graft, then she didn't have any option because the only option that they had before were biopolymers, which are really unhealthy, really unsafe, and they have really, really, really bad results. So the implants are a wonderful choice if you're looking to get a good result and you don't have enough fat for it. The implant has also another benefit, it's the fact that there is not going to be reabsorption like a BBL. Fat reabsorption is one of the complications of a BBL. Let's say you put an implant, let's say 300, and you lose weight. You're not going to lose the volume of the implant because you're not going to lose weight on the implant. The implant also will give you projection, will give you dimensions. Your bottom will look more perky, rounder, more athletic. Normally the implant goes inside the muscle. It's a pocket that we make inside the muscle. That way when you walk, it moves naturally with the muscle, so it doesn't look unreal, it looks yours.
Hay una pacientita preguntándonos.
Do payment plans.
Yo entiendo que ella está preguntando que si usted.
Detalles para pago.
Si tiene algún
okay.
plan de pago
Okay.
en inglés.
Alright. We don't have a payment plan per se, we have different payment options. We do accept credit cards. We do work with some different centers, and some of the centers will have payment facilities. But generally speaking, if you're looking for financial, we don't work with financial credit for the procedure.
Okay. Vamos a hablar, doctora, ahora. Vamos a hablar, doctora, ahora acerca de cuánto tiempo después de cirugía las pacientes tienen que iniciar la caminata.
Ay, sí. Ok, mira, yo soy y siempre he sido a favor de la deambulación precoz. Se ha comprobado que una de las cosas más importantes es la paciente volver a caminar relativamente rápido después del procedimiento. El caminar va a aumentar el retorno venoso, lo que al mismo tiempo va a disminuir el edema. Pero además de eso va a facilitar que las venas puedan movilizar de manera adecuada el fluido, evitando los trombos. Normalmente a nuestros pacientes nosotros tratamos de sentarlo entre aproximadamente 4 o 5 horas después del procedimiento, aunque usamos las botas de presión neumática y usamos las medias, porque entendemos que una vez que el paciente poquito a poquito se va instalando y se acostumbra, le pierde el miedo a caminar, se da cuenta de lo conveniente que es. Uno de los motivos también es que le causa menos dolor, porque cuando te pasas el día entero acostado, como no te puedes lateralizar normalmente después de la cirugía, el mantenerte en una misma posición te causa mucho dolor, porque es como que te deja frisado en una misma posición, que normalmente a todo esto es una posición donde se trabajó, porque si yo te hice lipo en la espalda, aunque tú no estés viendo una cicatriz en la espalda, es como que tú estés acostado 24 horas encima de un pelado.
Exacto. Okay.
En inglés.
En inglés.
All right. So I'm really pro early walking. It's proven that it's really helpful for a patient to start walking as fast as she can after the procedure. Even though we do use the pneumatic boots and we do use the socks, we normally will sit down our patient a few hours after the procedure to make sure that she's used to the concept. Because if you don't walk, this is the same, by walking, you'll increase the chances of having a faster recuperation and avoid complications like thrombosis and so on. Normally, another thing that we try to make our patients understand is that if you're laying down the whole time, you're not going to get better because the position is really painful. If you stay in the same position for long periods of time, it's going to be really uncomfortable, especially if that area has been treated. Let's say we do liposuction on your back. It's like you're sitting on top of a wound 24 hours. It's really painful.
Okay. Someone is asking, like, for someone that's getting an arm lift, can an implant be placed through that incision?
I'm sorry?
The question was like, if someone is getting an arm lift,
Mm-hmm.
can an implant be placed through that incision?
But are you talking about bicep implant?
Yeah.
Yeah, sure. You could, but it's not recommended because this is the thing. If I'm putting an implant and I'm taking a skin, I may have short of skin because this is the thing. If I'm putting an implant, then I'm increasing the size. If I'm taking a skin, I'm decreasing the size. So it goes backwards. So perhaps yes, by placing the implant, you will have enough results. If you do have a lot of loose skin, you might be able to pull it off. But I suggest for you to be careful with that because sometimes you can have wound adhesives.
I think she's asking for a breast implant.
No, you cannot put a breast implant through your arm.
Okay, so the answer will be no then, if it's a breast
No.
implant. Okay.
But I'll try to work on that.
Oh.
Ok, vamos a hablar, doctora, acerca de la transferencia de grasa a los senos.
Sí.
¿Trabajamos eso? ¿Usted
Sí,
trabaja esa
claro,
parte?
claro. Aparte de lo que la mayoría de las personas que trabajamos con reconstrucción mamaria hacemos. Es una técnica que al principio tenía ciertos niveles de resistencia por muchos especialistas, porque en ocasiones el miedo que generaba era que como los senos son zonas muy sensibles y zonas que tienen a veces pequeños nodulitos y pequeñas lecciones, a veces si ese pequeño nódulo tuviera algún tipo de lección maligna y le estamos poniendo grasa arriba, lo estuviéramos alimentando. Entonces había ciertos niveles de miedo, pero hoy en día el escaneo mamario está mucho más eficiente. Entonces, una mamá que esté sana, un paciente que esté sana, es evidentemente un buen candidato para una transferencia de grasa. Los resultados son muy buenos, son sumamente naturales. Lo que sí es que no es recomendable cuando son grandes volúmenes, porque el problema es que cuando son mucho volumen, la grasa no sobrevive de manera eficiente porque no tiene el espacio suficiente. A diferencia de los glúteos que tienen mucha vascularización y mucho movimiento, los senos son un poquito más estáticos y la sangre le llega por vías muy específicas. Entonces, cuando se coloca mucho volumen en ocasión, parte de ese volumen acaba perdiéndose y deja un poquito de irregularidades. Lo hacemos mucho con pacientes de reconstrucción mamaria porque en ocasiones necesitamos dejar ambas mamas lo más parecido posible. Y si ya la diferencia es sutil, el pensar en un implante, por más pequeño que sea el implante, requeriría que trabajemos el otro seno. Y a veces si la paciente está satisfecha con su seno, esas pequeñas correcciones con grasa permiten que se tenga resultados sin necesitar un implante.
Okay.
Y en ese caso, por ejemplo, podría ser escalonado, diferentes, vamos a decir, un aumento escalonado en la cantidad de grasa.
Las reconstrucciones normalmente son cirugías de más de una cirugía. En ocasiones se puede necesitar, por ejemplo, es el caso más claro, digamos, cuando se necesita un expansor, que yo necesito crear el tejido. O sea que sí, hay cosas que se pueden hacer paso a paso.
Okay. ¿Y para nuestras chicas en inglés?
Alright, so we were talking about fat transfer to the breast. It's a technique that has grown in terms of use. Normally we suggest to use it in small corrections because we have noticed that when we use it to big corrections, the results are not that good. It's a great technique when you're trying to, especially for breast reconstruction. We do work with it and it has good results. We just try to avoid it when it's large quantities because it's not really that safe.
Okay.
So, after all of the due process, how many follow-ups do a patient will need with you before going home? And what will be the minimum time for a patient to be here?
Well, for a mixed procedure, the minimal time should be at least 17 days. And I normally see her at least 5 times. I normally will see them 6 actually, because I kind of like to keep them close. Because since they're leaving, I like to give as much attention possible. That way they leave as ready as possible.
Okay.
Okay, perfecto. Hablemos entonces ahora, doctor. Sabemos que usted hace todos los tipos de cirugía estética, pero vamos a hablar de la cirugía de la rinoplastia, que yo sé que le encanta ese tema. Vamos a tocar ese tema, que fácilmente nos tiene de paciente por aquí. Cuéntenos un poquito de la rinoplastia, doctor.
Ok, una de las cirugías más versátiles, nos permite tener excelentes resultados porque es una cirugía con la que se puede cambiar la arquitectura del órgano. La nariz es un órgano que además de la parte estética tiene una parte funcional, ¿no? O sea que una de las cosas más importantes cuando se trabaja nariz es que la parte funcional no se comprometa. Pues no hacemos nada con tener una nariz bonita y que no podamos respirar.
Exacto.
Hoy en día existen muchas técnicas. Existe la técnica quizás más popular, que es la más común, que es la técnica abierta, donde se hace un pequeño corte en la base de la nariz y se levanta el tejido y se rearquitectura la nariz de manera eficiente. Está la técnica cerrada, donde todos los cortes se hacen por dentro. Realmente, ¿qué es lo que pasa? La nariz es un órgano sumamente complejo porque tiene absolutamente todo. Tiene cartílago, tiene hueso, tiene piel, tiene músculo, tiene ligamento. Entonces, al ser tan complejo en un espacio tan pequeño, tenemos que identificar qué es lo que necesita el paciente en específico para saber cómo rearquitectar su nariz. Una nariz, por ejemplo, me voy a citar yo mismo como ejemplo, con una punta que necesite más elevación. Si solamente elevamos la punta, la paciente va a quedar puerquita.
Exacto.
Entonces, no es solamente la rearquitectura de la estructura que necesita la modificación, sino modificarlo y readaptarlo al conjunto global.
Okay. English?
Sure. So, rhinoplasty is one of my favorite fields. I really like talking about it. I really like enjoying doing them. Generally speaking, a rhinoplasty is a complex procedure because the nose is a complex organ, because it has function. We don't do anything by making your nose prettier and you not being able to breathe. So we need to preserve its function. And in order to do that, we need to study it. So one of the things that's more important in a rhinoplasty is the previous studies. In some cases, you might need an MRI. In most cases. One of the things, and another thing is to understand that the nose has everything. It has cartilage, it has muscle, it has ligaments, it has skin, it has muscle. So in order for us to reshape and redress your nose, we need to understand that it's not a need of the region. Let's say I want to raise my tip. If I only raise my tip, then I'll look like a pig. We need to make sure to readdress the whole concept and the whole structure of the nose. We can do that openly, by making a small cut on the base of the nose, or we can do it close by doing it through the incisors.
Ok, perfecto. Continuando con la rinoplastia, ¿qué tiempo de recuperación una paciente con rinoplastia tiene que durar acá en el país?
Mira,
¿Qué esperan ella después de la rinoplastia?
Por increíble que parezca, la nariz no duele. Vamos a comenzar por ahí.
¿No duele?
Para nada. Ni siquiera hecha por residentes, o sea, ni siquiera en el momento, que es lo más irónico, porque es un órgano muy sensible, o sea, cualquier cosa que te hace en la nariz te molesta.
Sí, claro.
Pero la cirugía no duele. Y normalmente, aunque cuando hay fractura los ojos se hinchan mucho, el edema per se de la nariz no dura tanto. O sea que es una cirugía que si la paciente viene al país entre 10 a 12 días puede operarse de manera tranquila y irse de manera tranquila. Es un mito que durante el avión la presión le va a explotar los puntos. Es un mito que el cartílago se puede de repente de la nada doblar. Existen muchos mitos, la gran mayoría son mitos, y si la cirugía está hecha de manera adecuada y tú llevaste tu recuperación, que normalmente va a necesitar un molde o yeso para fijar la fractura, una vez que esté estable, eso se queda estable.
English.
Alright, so for patients that are coming for a rhinoplasty, they need to understand that they need to be in the country between 10 to 12 days. It's a really safe procedure. Incredibly, you may not believe it, but a nose job doesn't hurt. It's not painful. It's not a painful procedure at all. You do have some bruising, especially if you have fracture, and the bruising will be under your eyes. And you do have some level of discomfort because you're not able to breathe properly for the first 5 days. But after that, everything should be fine, and it's a myth that if you're going into the plane 10 days after the procedure, your nose is going to blow up.
Okay. For the case of anesthetics, should be different from like normal surgery and rhinoplasty. What will be the difference for anesthetic procedures in both kind of patients?
Alright, so if you're doing a rhinoplasty, you need to understand that it will depend if we are doing a fracture of your nose or not. If you're making a fracture, we might need general anesthesia because sometimes when we do local anesthesia, the patient will relax and will go to sleep, but it'll feel a little bit, and there's a risk of the patient actually breathing some of the blood. So if we're doing a fracture, then it's gonna be perhaps general anesthesia. If we're only treating the tip and we're doing a small correction, perhaps local anesthesia will be enough, but it's not the common case if we're talking about a full rhinoplasty.
Okay, good. So you just spoke before when we were talking about implants, about the biopolymers. There are some patients that unfortunately have them implanted in their bodies. So do you work with those kind of patients? Would
Yes.
you help them out in any ways?
Yes, I do have great experience with removal of polypolymers. I do it differently. I don't do an open surgery, I do a closed surgery directed by sonogram. Actually, we're doing one tomorrow. If possible, I'll try to broadcast part of it. What we do is we first do an MRI to locate the substance. Once it's located, we'll do a sonogram with our sonograph to create a map. When that map is created, we're able to actually extract the substance directly, and we don't have to leave any scars. So it's a great procedure with a great result and minimal scar.
We will be quite anxious to see it, the follow-ups to that case then. Well, so then what will be the expectations like? You said that there won't be any scars, but related to any further procedure or any
Yes,
any other things that could follow
Yeah,
up?
it is possible because we are removing that we may need eventually. You know, when I said eventually, it's because we don't suggest to do it at the same procedure, but sometimes volume gets lost. Let's say you're used to having a lot of volume on your bottom, and we remove that substance, and you're gonna feel empty because we did remove the substance. In those cases, most of the cases, we do use body implants later on. If it's bottom we're talking about. If we're talking about a face polypolymers in the face, there's options. We can use hyaluronic acid or your own fat, and in some cases we also can do a facelift.
Okay, good. Well, that's a good point, the facelift. In which kind of patients will be a facelift recommended? Like, what kind of patients are the ones that qualify for that kind of procedure?
Alright, so normally the patient will be a more adult patient, more mature patient, perhaps late 40s, early 50s, and in most cases that patient it will be Caucasian because people with darker skin they age later. It takes a little bit more time. It's common for Caucasian patients to age younger. In most of the cases, they will have loose skin, especially in the region of the neck, cheekbones, and in the front lines. There's different techniques and different kinds of approach. A lower third facelift is most common right now, and it has great results.
Okay. So, in talking on, let's say, mature patients, which there are other procedures that are performed in the face, for example, Botox injections and hyaluronic acid fillings, do you work with that, and
Yes.
what will be your approach to those kind of procedures?
Botox, it's something that normally I do in younger patients because Botox is more something to avoid a wrinkle. It's something that you use to prevent the wrinkle. When the wrinkle is formed, when the wrinkle it's there, normally it'll require surgery. Botox is something that you do to avoid a wrinkle, and it has great results. So a patient in the middle of the 30s, early 40s is a great patient for Botox. Hyaluronic acids in some cases in younger patients, for patients that have lost a lot of weight, when they lose a lot of weight, some of the marks of the face tend to be a little bit more visual. In patients that got a little bit older as well.
Okay.
Okay. Perfecto. Vamos a hablar, doctor, de las cirugías de los muslos. siempre hago esta pregunta porque es la pregunta que las pacientes más nos hacen. Las pacientes que pierden peso, mucho peso, que necesitan la cirugía en los muslos. Cuéntenos acerca de ese tipo de cirugía en el caso suyo.
Ok, lo primero, muchas veces las pacientes que han perdido mucho peso desean una cirugía mixta y hay partes de la cirugía que van contramano. Por ejemplo, si yo hago un tummy tuck, yo estoy, entre comillas y paréntesis, jalando el área genital hacia arriba. Si yo hago un levantamiento de muslo, yo estoy teóricamente jalando el área genital hacia abajo. O sea que evidentemente esos procedimientos no son compatibles. O sea que si estamos pensando en un tummy tuck, evidentemente que quizás no sea el momento de hacer un levantamiento de muslo. Normalmente la cicatriz del levantamiento de muslo tratamos de hacerla en la línea del panty. No siempre es posible reservarnos solamente hacia esa línea y en ocasiones hay que hacer una cicatriz que va lineal descendiendo de manera vertical, pero en la gran mayoría de casos, principalmente en pacientes que tengan algún tipo de ascendencia latina o afroamericana, que tienen una piel un poquito más fuerte, con una cicatriz en la línea del panty tiene un excelente resultado.
Ok, perfecto. English.
Alright, so thigh lift, it's something that, as you guys can understand, could be mixed with some procedures but never with a tummy tuck. When you do a tummy tuck, you're pulling the genital region up. When you do a thigh lift, you're pulling the genital region down. So it's not really a good match. Normally we'll try to do it between the underwear line, that way the scar is not visible. In patients that are a little bit more dark or Latin patients, that should be enough because they have a stronger skin. But in Caucasian patients, so patients that have lost a lot of weight, a longer scar might be needed.
Okay. In that same subject, usually the patients with thigh lift, they are always kind of scared because it's difficult to move, it's difficult to be in bed in normal position. What will be the care that the patient should take and what they should expect after the surgery?
The main problem is humidity because it's a region that normally tends to get wet and it tends to accumulate humidity. So the bigger problem in those kind of procedures is the humidity. So we keep our patients really dry. Sometimes we actually use maxi pads and so on to keep that region extra dry. Because if it's dry, it's really well manageable. But if it gets wet and stays wet, there's a possibility of infection.
So what will be the time that it will take, like, for the patient to, to recover or to be more or less out of danger?
I would say around 7 to 10 days.
Okay. ¿Algún consejo que le quieras dar, doctor Clime, a sus pacientes que están por venir a hacer cirugía acá y ya después de que están en su hogar después de cirugía?
Miren, 4 cosas importantes. Primero, busquen médicos certificados. No, eso no significa que me busquen a mí, significa que busquen médicos que tengan las certificaciones adecuadas. Ustedes pueden visitar la página de la SOCIPRE, que es la Sociedad Dominicana de Cirugía Plástica. Pueden visitar la página de la Federación Ibero-Latinoamericana. O pueden visitar la página de la ISAPS, International Society of Plastic Surgery. Ustedes ponen República Dominicana y ustedes ven los médicos que están certificados. Eso es sumamente importante, eso les va a ayudar a que el procedimiento sea un procedimiento seguro. Ya cuando se retiren a su país, entiendan que la cirugía no acaba porque ustedes se hayan ido del país. Los resultados de cualquier procedimiento, principalmente de control corporal, se comienzan a discutir realmente a los 3 meses después. Entonces, mantener el tratamiento, mantener la dieta, mantener el uso de la faja, mantener una buena higiene es fundamental para que el resultado permanezca. Es muy incómodo para nosotros como profesionales someter a un paciente a un procedimiento complejo, quirúrgico, y que el resultado final no sea satisfactorio porque el paciente no siguió el protocolo. O sea que, por favor, hablen con su médico, consúltenlo, busquen la manera de entenderse. Todo se puede manejar si hay una buena línea de comunicación entre el paciente y el médico.
English?
Sure. Alright, so look for certified surgeons. That will be the first tip I can give you if you're planning to have a surgery abroad. You can look at it at the site of CIPRE, which is the Dominican Plastic Surgery Society, or the Federation, the Ibero-Latino-American Federation, or just go to the ISAPS website. International Society of Plastic Surgery. You put Dominican Republic, and you look for the certified surgeons in that website. It should be really easy. One of the things that you guys need to understand is the fact that you guys are leaving doesn't mean that the procedure is over. So if you're coming for 14 days, 20 days, a month, You need to understand that a body contouring procedure normally will take 3 months to have the real results. Sometimes longer, sometimes can take up to 6 months. So please follow protocol, talk to your doctor, wear your garments, keep your medications, be safe. We are really happy to serve you. It's our pleasure, but please help us out.
Y para terminar, una preguntita nos hacen por aquí. ¿Cuántas pacientes por día usted opera?
Una paciente por día.
English.
I only do one procedure a day, and that's because I think every patient deserves 100%. I don't see a way for me to be 100% available for a patient if I do more than that. So it's one procedure per day.
Ok, fue un placer para nosotros
El placer fue mío.
compartir contigo. Es una excelente entrevista. Me siento, teniéndote enfrente, me siento en familia. Se me hace difícil hacer la entrevista más profesional. Pero nada, fue un placer. Esperamos verte próximamente. Ya sabes que estamos siempre disponibles para ti.
Lo mismo digo.
Es un placer tenerte con el gran equipo de cirujanos que tenemos en Surgeon.
Sí.
Es increíble como...
Tiene mucha gente buena.
Sí. Todas las chicas que necesiten una cotización contigo, aparte de comunicarse con nosotros vía Surgeon o vía mi WhatsApp, danos tu información para que te puedan...
Sí, realmente yo soy muy asequible. Uno de los motivos por los que opero solo un paciente por día es eso. Realmente me pueden contactar vía email o vía mi website. Mi website es sumamente fácil, Enriquillo.com. Y en mi website están todas las informaciones.
Tu Instagram.
Enriquillo también, es que es muy fácil.
Es muy fácil y tú estás contestando siempre en todo.
Sí.
Yo sé que sí. Pues muchísimas gracias y nos veremos prontito.
Yo lo quiero.
Bye bye.